Have you ever stopped to think that the way you talk at the doctor's office could actually affect the care you receive? Many older adults don't realize it, but the words you use, your tone, and even how you describe your concerns can make all the difference. I'm not talking about fancy medical terms or knowing every detail of your health history. I'm talking about small everyday habits in conversation that can quietly work against you. Here's the truth: doctors can only help with the information you give them. If that information is vague, incomplete, or softened, even the best doctor might miss something important. And this isn't about blaming yourself. Most seniors fall into these habits without even noticing. Often it comes from wanting to be polite, not wanting to complain, or assuming that certain aches and issues are just part of getting older. But in reality, these little conversational patterns can have big consequences. You could miss out on treatment options, delay an important diagnosis, or walk away without really understanding your next steps. That's why in this video, we're diving into the 5 hidden ways seniors sometimes speak at the doctor's office that can harm their health, and more importantly, how to avoid them. Stick with me until the end, because the last one is something even the most thoughtful patients often get wrong, and fixing it could change every future appointment you have. Mistake number 1: downplaying or minimizing symptoms. This is one of the most common issues. It sounds like saying, "Oh, it's nothing serious, just a little ache," or "I don't want to bother you with this." While you may think you're being polite, you're actually making it harder for the doctor to understand what's really going on. Doctors rely on the details you share to piece together the full picture. If you leave things out or soften your words, you're giving them an incomplete puzzle. And that can be risky. Many older adults do this because they don't want to complain or seem dramatic. But what you think is minor could actually be an early warning sign. Take my neighbor Helen, for example. At 78, she had been living with tightness in her chest for weeks. She brushed it off as just age. But when she casually mentioned it during a checkup, her doctor immediately ordered more tests. It turned out to be a serious heart condition that needed urgent treatment. Helen later admitted that if she'd kept quiet, things could have ended very differently. Her story is a powerful reminder: what feels small to you could look very different to a trained professional. The best approach is to describe your symptoms exactly as they are. If pain has lasted 3 weeks, say 3 weeks. If your sleep is disrupted every night, be clear about it. If it affects your daily life, explain how. You're not complaining, you're providing the facts your doctor needs to protect your health and independence. And trust me, a good doctor will thank you for being clear and honest. Mistake number 2: speaking in vague or unclear terms. Another habit that often creates problems is being too general. Many older adults say things like, "I just feel off," or "it hurts," without explaining when, where, or how. While those words may make sense to you, they leave your doctor guessing. And in healthcare, guessing is dangerous. The more vague your description, the harder it is to find the real cause. That means your diagnosis might be delayed, or worse, wrong. Instead, be as specific as possible. Tell your doctor when the pain started, how often it happens, what makes it better, and what makes it worse. These details aren't small talk, they're the clues that lead to answers. Mistake number 3: not asking questions or pretending to understand. A lot of seniors walk out of a doctor's appointment without fully understanding what was said. Maybe the doctor used medical terms, spoke too quickly, or gave instructions that weren't clear. Instead of asking for clarification, many people just nod politely, thinking, "I'll figure it out later." But here's the danger: if you don't fully understand your diagnosis, your medications, or your next steps, it's almost impossible to follow through correctly. A wrong dosage, a missed follow-up, or confusion about what to watch for can all put your health at risk. Doctors are human, they may assume you understood unless you speak up. There's absolutely no shame in saying, "Can you explain that again?" or "Could you say that in simpler words?" In fact, good doctors expect questions. It shows you're engaged in your care. I once spoke with a gentleman in his 80s who was prescribed a new medication. He didn't ask how to take it properly and assumed once a day meant morning or night, whichever he preferred. But in his case, timing was critical. It wasn't until a pharmacist noticed the mistake that things were corrected. That small misunderstanding could have caused serious complications. So remember this: if you leave the office confused, it's not on you, it's a communication gap. Always ask until you're clear. Mistake number 4, hiding sensitive or embarrassing details. This one is tough, but it happens all the time. Many older adults avoid talking about issues that feel too personal. Things like bowel changes, bladder problems, memory lapses, sexual health, or even mental health struggles. Out of embarrassment, these concerns often get brushed under the rug. But here's the hard truth: the things you feel most hesitant to share are often the most important clues for your doctor. A problem you're embarrassed to talk about might point directly to a condition that needs urgent attention. I remember a friend's father who ignored constant bathroom trips at night. He didn't mention it for months because he thought it was just aging and felt embarrassed. Eventually, when he finally told his doctor, they discovered an enlarged prostate that needed treatment. By waiting, his symptoms worsened and made life far more difficult than it needed to be. Doctors hear it all: nothing you say will shock them. And everything you hold back could delay proper care. The more open and honest you are, the better they can help. Mistake number 5, not bringing notes or forgetting key information. Finally, one of the most overlooked habits is walking into an appointment without preparation. Memory slips are common at any age, but especially later in life. Many seniors forget to mention certain symptoms, changes in medication, or even important questions they had in mind. By the time the appointment is over, they realize they left out half of what they wanted to say. This can completely change the outcome of your visit. If your doctor doesn't have the full picture, they can't give you the best advice or treatment. One of the simplest fixes is also the most powerful: bring a written list. Write down your symptoms, when they started, how often they occur, and any medications or supplements you take. If you have questions, write those down too. Having notes not only keeps you organized but also ensures nothing slips through the cracks. I've met seniors who started bringing a small notebook to every appointment. They told me it completely changed their experience. They felt more in control, more respected, and more confident in the care they received. So, let's recap the 5 communication mistakes to avoid at the doctor's office. 1. Downplaying symptoms. 2. Speaking vaguely. 3. Not asking questions. 4. Hiding embarrassing details. 5. Forgetting key information. These may seem small, but together they can have a massive impact on your health. The good news? Every single one of these habits can be changed, starting with your very next appointment. Remember, your doctor is your partner, not your judge. Clear, honest, and specific communication is the key to making that partnership work. Don't be afraid to speak up, be direct, and make sure you truly understand what's being said. Because when you do, you're not just being a good patient, you're taking charge of your health, your independence, and your future.